Welcome to another edition of Health Department Roundtable. I'm your host, Chris Schultz, current chair of the Board of Health, and with me today is our public health nurse, Lindsay Wright, and our health director, Marty Golightly. How are you both today?
Outstanding. How are you?
Well, how are you?
Excellent. Awake on a Saturday morning.
Happy Saturday.
So we'll start off with our typical take a look at the numbers in Abington and see where we are today. Lindsay, you have one?
Yeah. I cleared some cases this morning, so we're at 32 active cases. We have 31 individuals quarantined related to being exposures of a positive case, and we have 1,698 cases that have been discontinued from tracking.
Excellent. And I know there some people were confused about that. That's people that have recovered, right? Or are no longer.
Well,
It's a number of things, right?
Those are people that we do not have to track for COVID-19 anymore.
Excellent. And I will comment. I noticed. All right, so we're on a bit of an uptick at 32. The quarantine number seems low. Like I think in the past we've usually had like twice to three times as many people quarantined. So is that a good sign?
Yeah, that's true. And the current uptick, I mean. I think we were at a low of 24 at one point last week.
Yep.
But we've been pretty steady around 30 for the last, I want to say almost a month, plus or minus a couple. So, I mean, I'm still cautiously optimistic and very hopeful that these numbers will continue to decrease. And we have no indication that they won't, as long as people remain mindful. And as long as our vaccination numbers go up. And as long as St. Patrick's Day is not, well, that's not the holiday that everybody should go and, hanging out inside en masse and all that stuff. But
yeah.
I'm still cautiously optimistic.
So vaccinations, you have an update on where we are with that?
The state put out a very interesting website, and you can find it at mass.gov. If you Google vaccination numbers and you go there, you can actually look at the percentage populations of Abington and every other town in the Commonwealth that has had vaccination, that have tracked vaccination. You can see where we are per capita, where we are percentage-wise based on an age range, and we're trending at or above the general numbers of everybody else. And we were able to do another vaccination clinic on Thursday of this week. We got a vast majority of the educators in town, and we worked out our wait list that we put together a couple weeks ago, almost a month and a half ago now. Wow,
that's a long time ago.
Of our seniors who had called either my office or the senior center. We're working down that wait list first because that's the fairest thing to do. So as soon as we clear that wait list, we'll either start taking more or we'll figure out a newer, better way to do it. So we called those people on the wait list for Thursday. We did some of our educators and our pre-K people at the preschools in town, and we are hopeful to do that again next week. But a lot can happen between now and Wednesday afternoon when we'll have our clinic.
Well, the president says we'll all have shots by May 1st, right? So we can be hopeful about that.
Well, the state had better involve local public health then, because the only way they're going to get that done is to involve local public health. It's going to come a time where they're going to need our help. And a lot of these communities who felt hard done by being left out of the decision-making process, of all of the plans and things, they might not want to participate anymore. And I don't blame them. But it's not in my nature to not want to continue to do it locally, but I don't blame some of the other communities. They're like, you know what? It's not worth the headache and the aggravation that the state is making it. So why? And there's no benefit in doing it other than, to get those people who can't get there. So, I mean, I get it, but we're not going to be like that. We're going to continue to make Abington a gold star as far as local distribution and vaccination efforts.
Yeah, and I can attest. Thursday, I had the pleasure of being at the clinic and seeing you guys at work. One of the smoothest running operations I've seen, or for anything, let alone a vaccination clinic. So much so that when I went to look to help, like there really wasn't much for me to do because everybody had it under control, which is awesome.
That's a good problem to have. Lindsay, you were going to say something?
I was just about vaccines. We have reached out to several different resources within town to help us identify homebound seniors and homebound residents. It doesn't have to be seniors. If you cannot get out of your house, bedbound, you have multiple factors that limit you from leaving, call me, please. We can come to you. I have, at this point, I have a list and we're working through it. Justin Silver and I we've gone out a couple days and have started this process, but if we are unaware of your situation, I can't help. So just give us a call and we'll get it done as quickly as we can.
You've done about, what, a dozen so far? People that just cannot leave their house? In that neighborhood, at least, right?
About 18, I think.
So a dozen and a half. So if you're a faith leader or a member of your community in this, or you know of somebody, reach out to them so that they can reach out to us, or reach out to us on their behalf and we'll give them a call. One of our biggest goals is to get those people who would otherwise not get it done because of mobility issues or because of something. So we will either go to them, or in the case of Thursday, we actually used the senior van and we went to some houses and picked up some of our senior residents and brought them to the Council on Aging and gave them their shot there. So we have a few different interesting methods that if you need assistance, we will assist you.
I've had at least one person reach out to the Board of Health through Facebook. So it's just a reminder to anyone listening, definitely call the Health Department. The phone number is 781-982-2119. That's the fastest way to get assistance.
And just to clear up any confusion, we're still not getting specific set aside first dose from the state. What we'll use are any surplus second dose shots. So that's what we're using to give shots. So we still can't say with any certainty we will have a clinic. It is more like we are hopeful to provide a clinic. It's not, nothing is a guarantee because the state is just not sharing the vaccine with local public health. So while we are hopeful we'll have another one this week, I can't promise it, but it won't be for lack of effort.
And as far as the state, I haven't checked it out myself, but apparently now on the website, you can pre-register if you're qualified for a vaccination, and then you will be notified via text or email or call.
Yes. And thank you for bringing that up because I wanted to talk about that too. If you have problems navigating the website, if you're just one of those people that, computers aren't your thing, call us. We will do it for you.
Yeah. If you don't have a computer, if you know of someone who needs to get on the list, I know I put a couple people assisted with sending them the link. And then also, I know Angela, Mary, and I just didn't happen to hear you, Marty, specifically on the phone doing it, but we've all helped people get on the list.
No problem doing that.
The one thing that it was not clear, Marty, I don't know if you know the answer to this, was where. It is one of the 7 mass vaccination sites that you get set up with an appointment. I don't know how the state is figuring out geographically who goes where.
Neither do I, and I have a bad feeling it will be first come, first serve. So you could sign up for this pre-registration and then get a slot in like Danvers, which we all know is ridiculous, but in my opinion, it might be worth a drive. But call if you have any technical issues, call us. We will put you on that registration list to be able to get an appointment in the future.
Excellent. So one thing that I wanted to cover with the two of you while I have you, daylight savings is this weekend. We're springing ahead. Today is an exception, but the weather has been warmer. As we're moving into spring and people are moving more outdoors and doing activities, any particular guidance you would suggest for, I know we need to remain vigilant. Any words of wisdom for folks as they start to go back outside and enjoy the weather?
No, other than wear your helmet if you're riding your bike, like those normal safety things, right? Wear your seatbelt, don't drink and drive, like that kind of stuff. continue to wear your mask. We all know it's annoying. Nobody really likes it, but it's the thing that we know that, flu numbers this year were extraordinarily low because we were all wearing masks. But specific to daylight savings, I'm happy. I went for a bike ride yesterday and it was amazing. I'm an outdoor kid, in both, actually. I'm kind of an indoor kid too. Anyway, go outside, wear your helmet, get outside, go get some vitamin D. That's good for your immune system. Exercise is good for your immune system. Go outside and play. Just be smart, try to maintain your distances as much as possible. Hang out with your own family unit. The CDC released guidelines on what fully vaccinated people can and cannot do. Review that. And just continue to do your best. We have a good community of people willing to do their best and willing to help their neighbors. So let's just keep that moving. We can see the finish line, but we can't. Don't celebrate till you get in the end zone.
Yeah, let's not trip on the goal line.
Yeah.
Something that's not COVID related, yay! But daylight savings time, being the public health nurse for the town, and also happen to be a firefighter's wife. Check the batteries in your smoke detectors. This is this weekend.
Yeah.
You should do that.
We'll throw that in there too.
Good advice.
All right. Well, I want to thank the two of you for joining us again today, and remind our viewers, if you have any specific questions you'd like addressed or anything you'd like us to talk about, please feel free to reach out either through the Health Department, Abington CAM, or the Abington Board of Health's Facebook page. Or you can email me directly through the abingtonma.gov website.
That's it.
Thank you again, and we'll catch up with you next week.
Can I add one more thing before we go? I just want to give a wholehearted and a big thank you to all of our Abington MRC volunteers. Their efforts have been nothing short of spectacular. Anybody who's been to one of the clinics knows how eager to help they are. And of course, the firefighters. Couldn't do those things without our volunteers and our firefighters. So thank you very much, everybody. And we appreciate you.
Yes, thank you.
Thank you. All right, take care. Stay safe. Wear your masks. Wash your hands.